Welcome to Dysfunctions that make you go, Which dysfunction are you looking for when you assess the leg alignment in your clients? We at Syzygy found that changes in the femur mechanics during the loading phase of the step can cause a lot of problems in the lower extremity. We invite you to explore with us 5 common dysfunctions that we see in the lower extremity. We're going to look at the leg alignment test with our client Sarah. So if we take a look at Sarah's right leg, we see that once she lifts up the back leg, her knee shakes in and out. When she does it then, you can also look at the toes, how she's compensating by lifting up her toes while she's doing the leg alignment test. In this video, we'd like to focus our attention on ankle sprain, one of the most common injuries in the lower extremity, and is also one of our mentioned 5 common dysfunctions resulting from changed mechanics of the femur rotation. In order for you to understand why we have that train of thought, we go through the anatomy structures, the fascial lines, talk a little about the mechanics of the foot and the knee and the hip, so you can hopefully come to the same conclusions as we do. We start with the most common muscle everybody knows, the glute max. Huge muscle which comes from the ilium bone, the sacrum and the coccyx, and it inserts here to the femur and the IT band. So it had this course. The second muscle is the piriformis, which comes from the frontal side of the sacrum going into the femur. And we have the 2 gemelli muscles that come also from the ilium, go down to the femur. The 2 obturator muscles, one from here, one from the inside part, they all insert into the femur. And the last of these muscles is the Quadratus Femoris, which is the lowest one, also comes from the ilium and goes to the femur. So as you see from the course of these muscles, that they all have a course from inside to outside. Meaning on the hip, if something is on the back side of the hip and it comes from inside to outside, it has an external rotating force onto the hip, which also means, because it's the same bone, the knee and the hip, the femur, also an external rotation force on the knee. As we've seen in the test with Sarah, once she lifts up her back leg, she internally rotates her knee and comes out again. And also the feet, they were trying to compensate this. I mentioned this in the video when we talked about low arches, flat feet, pronated feet. So why am I talking now about an injury, the ankle sprain? Yeah, it's because once I have this dysfunction of an internally rotated knee, I put too much pressure on the medial side of my knee, which is, as mentioned also before in the meniscus and the cruciform videos, that this medial pressure, this medial rotation on the knee is not good for the passive structures, which can cause injuries, pain. So my body is trying to get out of that vicious cycle of these internal rotations, but it cannot do it at the right spot. So what is he trying to do? He's trying to externally force the leg. And this is by supinating the foot. So he's trying to have a force of lifting this one up in order to help the knee. And this is why it's a very common dysfunction to do this too much, because the body is used of compensating here instead of using the right force on external rotation. And this is why it's one of the most common dysfunctions to skip, to sprain the ankle, because once you put too much pressure on the outside, you just fall outside and then you have a problem with your ligaments on the external side of your ankle. So we hope that this video was helpful, and you can also find the same dysfunctions with your clients. You can help them prevent them from ankle injuries, because usually they don't just happen once, they happen all the time, and just because everybody has them, it doesn't mean that you can't do anything about it. If you think that our video was helpful and you'd like to know more, please visit us on our website. Thank you very much.